The Inland Empire Health Plan and Healthy Heart Nation have partnered for this series to discuss the importance of heart health in the African American community. Leading this conversation is Kenita Bourne, a licensed clinical social worker and the manager of social and community services at IEHP, and Dr. Columbus Batiste, a board-certified interventional cardiologist. Let's join this conversation where we will dive deep into crucial topics and provide you actionable tips to help you and your loved ones live heart-healthy lives.
All right, Doc. So with any condition, there are side effects.
Yeah.
So I'm sure with blood pressure, there are some side effects that will come with having high blood pressure for too long. Can you tell me a little bit about what that might look like?
Yeah. So, I mean, I won't necessarily call them side effects. What I'll say is it's just cause and effect. It's the results of having this high blood pressure. And one of the main ones, I always say is that having high blood pressure is like lifting weights. So I always analogize it, if you imagine Arnold Schwarzenegger back in his heyday, he's on Venice Beach, he's pumping the iron out there, and he's just going there stacking the plates on both sides. Mm-hmm. After a while, he starts to get pumped up.
Because he wants to pump?
He wants to pump you up. That's right. And so the muscles get big and they get thick. The same thing happens with the heart muscle. Mm-hmm. The heart muscle, as a result of high blood pressure, begins by getting thick. And we think that bigger is better, right? The size matters. But in this instance, it actually doesn't. So it becomes too stiff. Now it doesn't relax very well. So when the heart doesn't relax very well, then the pressure can build up quickly and a person can become short of breath. We call that heart failure with preserved heart function or preserved ejection fraction. But over time, imagine if Arnold Schwarzenegger had to keep lifting that weight continually. Doesn't matter how strong he is, eventually he's going to fail. Doesn't matter, his muscles now are going to fail and he's not going to be able to lift that weight. So the heart, after a while, it begins to fail. It starts to dilate and stretch. And now we develop what's called heart failure with reduced ejection fraction or reduced function. And so this paradigm is the most common effect from high blood pressure. Got
it. And you just said so many things that make sense to me, right? Because I work out sometimes.
All right.
Right?
All right.
Just a little bit. So, and sometimes you're working out with a trainer and they're like, you're going to do this one exercise to failure.
Yeah.
Right?
Yes.
And you're, doing your bicep curls to failure. So now you're at 120.
Yes.
Because that's how many I'm lifting.
Okay,
Don't
now,
judge me.
watch out.
But at one point, my arms cannot lift anymore. So what you're saying is that's what we're doing to our heart.
That's right.
If we have high blood pressure for too long. Like it's like lifting a weight to failure. So basically your heart, which is a muscle.
That's right.
Is failing us.
That's right.
And we don't want that to happen.
We do not want it to happen. This heart is so important. We have one heart. It's going to keep us a whole entire lifespan, right? And so we have to take care of it. And so the more that it's under strain and stress, the more likely problems are going to arise. And so in a similar analogy, we know the second most common cause is going to be kidneys dysfunction.
We know that? Who's we?
Well, we in medicine, which is why we always go probing and prodding you people who come in, our patients, and we're like, okay, we got to test you out, right? Okay. Why is that?
I don't know.
Because the concern is, remember I've said before that fire hydrant that's going and it's just disrupting everything? So when this blood pressure is so high and it's coursing through your vessels, imagine if that fireman were to drop that hose that's fully engaged. It's going to flap all around. So we know inside the body, the vasculature begins to kind of look tortuous, or it looks like a serpent. It's flailing up and down, and it takes like all of the circuitous routes. And that increased pressure causes damage to the kidneys. It causes damage to lead to strokes too as well, are the things that we see that start to take place as a result of persistently elevated blood pressure.
Sorry, Doc, I need to pause you for a second because I love how you're saying we know. I want it to be very clear that you in the medical community know. I don't know if the collective community, we understands that the heart that's up here, if it's not taken care of, is going to affect the kidney that's somewhere around here.
Yeah. So that's a problem with us.
Okay.
If we have not conveyed that information to you, that's why I'm here right now.
Okay.
Right? We're trying to we're breaking barriers right now. But I'm gonna tell you something else. It may not apply to you, but it may apply to a male cousin or a friend or whomever in your life one of the things that happens is that elevated blood pressure can result in something that can reduce a person's manhood. Their ability to raise the flag goes away. And
I'm sorry.
they lead to something called erectile dysfunction as a result of persistently elevated blood pressure, that damage to the arteries. And this is one of the ill effects from high blood pressure. Erectile dysfunction on top of kidney dysfunction.
Interesting. So it might not affect me directly, but let's be very clear. So what you're saying to me is the effects of blood pressure could be heart failure, kidney disease or failure, stroke, and erectile dysfunction.
Among many other things, yes. So it's so important that we take care of the heart. Now you know why I'm a cardiologist. The heart is important.
And if for nothing else, take care of your heart so you don't have ED.
I'm saying that makes the most important sense to me. in the world, right? We have to take care of this thing called the heart.
Yes.
Yes.
Wow.
Take care.
Doc, you just blew my mind.
Come on.
Okay. So you mentioned that because somehow the kidney is connected to having high blood pressure. Yeah. I know, one thing I do know is if you have kidney failure, there's a possibility to have to go on this thing called dialysis.
Yes.
Can you talk a little bit about that?
Yeah, so dialysis, basically, your kidneys are a filter. Mm-hmm. So I always kind of think about the kidney function is back when I was a kid, there was something called cheesecloth. I'm not sure if that's still there.
It's a thing.
And so imagine if you were to go and put tea leaves on top of that cheesecloth. That's going to strain the tea, right, as you pour water in there. You know how effective the cheesecloth is by how many tea leaves are inside the cup. The more tea leaves in the cup, you're like, this filter isn't working real well. High blood pressure damages the filter. That filter is your kidneys. So we can measure if the kidneys are not filtering effectively, and when they're no longer filtering appropriately, we can't just replace it like another slot in the body. We have to now take it to dialysis, where now we have a surrogate to filter the blood and to take out the toxins. And so one of the most common effects of this is high blood pressure along with diabetes for leading to kidney dysfunction or kidney failure.
Interesting. I have never heard it explained that way. So basically, we need assistance. I love how you said surrogate. We need a surrogate to help us filter out our tea bag, which is our blood.
That's right.
Is that accurate? Yeah. Through the kidney. And, you know, the reason I know about dialysis is because I've had a number of family members that had to be on dialysis. And planning a vacation was really difficult because wherever we went, we had to find a dialysis clinic or they couldn't go.
Yeah.
That is so crippling.
It's very common in the African American community. And my wife's dad, he had dialysis. He had high blood pressure from his 20s and 30s. Worked in the hospital with high blood pressure, led to kidney failure. And as a result, he was on dialysis for many years, had a transplant, eventually it failed, back on dialysis. So when you speak about having to plan vacations, that was their entire life, was playing around his dialysis 3 times a week, essentially for half of a day, 3-4 hours.
Wow.
So it's important that we take care of this thing called our body. And that's why we're here having this conversation about the importance of the heart and really the importance of high blood pressure, because it affects everything from our head to our toes.
Absolutely. You're going to have to tell me how to take care of my heart now because I need to go on vacation.